I'm a psychiatrist. I work at King's College London, and my background is that I served in the British military, in the Royal Navy and with the Royal Marines Commandos for about 23 years. I've been involved in quite a lot of crisis response work. So I was involved with our Foreign Office going out to New York after 9/11. I've helped out in the aftermath of the Bali bombings with the British individuals over there, and also after London bombings and a number of other kind of crises and disasters. Always looking from a psychological viewpoint about what's the best thing to do to try and reinforce teams and also protect mental health of the public. Post-traumatic stress disorder, PTSD as it's often known, is a mental health problem. So many of us, when we're exposed to traumatic events, we routinely have some symptoms. So we are a bit jumpy, we can't concentrate, we can't stop thinking about the event. And all of that is completely normal in the first few weeks. And for most of us, those symptoms kind of dissipate and go over time, and we get on with our lives. However, unfortunately, for some individuals, those symptoms persist and they cause difficulties. And over time, people find them very, very difficult to cope with. And they often end up developing other mental health conditions like depression or substance misuse, drinking too much alcohol or using drugs, because they're trying to cope with the trauma symptoms. And the key symptoms of PTSD are that you can't stop thinking about the event. So you might dream about it. You might even feel as if it's happening again. You tend to also avoid speaking about it or thinking about it, because each time you do it makes you feel really horrible. It changes the way you think about the world. It distorts your perceptions. So it makes you think that you're at fault or that someone else is to blame, when actually that wasn't the case. And lastly, it makes you very jumpy, stops you sleeping well, and makes you often quite irritable and at times even aggressive. And you put that all together and have it affect your life, and that's what PTSD is. Healthcare work has always been pretty traumatic at times. Certainly some areas of the healthcare service, routinely come across death and dying and destruction. And actually, they're a pretty resilient bunch of people, a bit like journalists or a bit like military personnel or emergency services personnel. But there's no doubt that actually some of them do get affected, and they do unfortunately develop mental health conditions like PTSD. Now, at the moment, obviously, we've got a lot of trauma going on. We've not only got the fact that there's death and dying, which is happening all rather a lot, but there's also what's called moral injury. So that's the injuries that result from not being able to do the right thing when you wanted to. Maybe you didn't have the right safety equipment, maybe you didn't have the right number of staff or the right training, or maybe there were too many patients at one time. And medical personnel and all sorts of healthcare workers want to really do the best for their patients. And when they're prevented from doing so because of the situation, that can cause them to have some really difficult emotions like shame or guilt or even anger. And then you can add on to that most of us find that we kind of decompress from a shift by maybe having a glass of wine or sitting around and chatting to people in a social setting. And of course, we can't do that now as easily. I'm not saying that you can't do that remotely, but it isn't quite the same as being in your team, sitting with your team and socializing with your team. And all the evidence we have from our studies of trauma-exposed organizations done at King's College London shows that actually the most protective bit of being at work is actually having a really supportive colleagues and a supervisor who really is able to have a psychologically savvy conversation. What we did is develop a plan from the scientific evidence that trying to showed us how we should make sure we provide the right support. So that started before people actually came to the hospital. So before they volunteered to do the work, and they were volunteers, we asked them to reflect about whether this work was really for them. So were they, for instance, living with someone who might be vulnerable and they might be worried about taking the infection home? Did they have lots of stressors going on in their life anyway? Had they been involved in previous traumas? And so we asked them to reflect on that and really decide, I thought about all that, but that's okay. Then before they started, we helped them develop some active coping skills, which was called psychological PPE, as a way of just giving it a name. And then when people actually went to actually do the work, going onto the wards, we made sure that they buddied up beforehand. So we actually said, you two, you keep a close eye on each other to make sure you're okay. We trained supervisors how to have psychologically savvy and supportive conversations to make sure that they could talk to their team colleagues. And we also had a group of people who we called welfare walkers, who are basically people who had some mental health training, but they weren't experts. And they were able to be around for when people changed shifts and also when they were off, coming off for a break. So it was a multi-stage level of support, which we put in place, I have to say, rather quickly over a few weeks. And, for the few weeks the hospital operated, I feel we did a pretty good job. What we've done with the Nightingale plan is actually, I think, to provide a blueprint for how we can support healthcare workers doing this incredible work going forward in the future. And what we think is really important at the moment is about what happens during this recovery phase, because it's not about just sustaining people at that front line to keep going, which is important. It's also about making sure that we bring them back and help them reset so they can both get back to normal. And also, if there is a second wave, as many of us think there will be, then they're ready to go again. What we can't do is to bring them back on a Tuesday and then say, well, on Thursday, could you try and help us catch up with all those appointments that we haven't had and those investigations? Because we know that if we do that, actually, we're going to end up creating some real casualties. And then if a second wave does happen, we're not going to have another group of staff ready to go again.